I have a giant like divot in my forehead, red and all that. And if you're watching it on YouTube, you probably do see it.
So what could this be? This could be a localized injury, trauma. It could be a localized skin infection like impetigo or very early shingles, although normally that would be a number of lesions. If you do have concern for either of those, however, I would suggest seeking care urgently. Could be a localized skin dermatitis or a other inflammatory condition. It could be a skin cancer or result of treatment of something. Um, those would be my main differentials. Could be, given it's fairly recent, it wouldn't be a congenital condition or a long-standing condition. Let's find out what it is.
I just want to let people know it's nothing to worry about. As you get older, you find that you have to go into the dermatologist on a regular basis, and he takes out uh, like a freezy ray, and he just points it at your face.
So I'm a skin GP. I'm not a dermatologist. You can come into us as well. The freezy ray I think he's talking about here is a cryotherapy canister. So applying liquid nitrogen cryotherapy to create a cold burn on the skin to obliterate superficial skin conditions like solar keratoses and superficial skin cancers in the right location with the right subtype, such as superficial BCC. There are some risks with that, and you should discuss that with your skin clinician. It would be very rare that we would treat other skin cancers like melanoma with cryotherapy. In fact, it would be very very rare for us to do that. Cryotherapy is approved for superficial conditions like superficial solar keratoses and superficial BCC, and in rare cases, malignant cryotherapy for superficial SCC. There are some nuance beyond that, but generally speaking, that's what it's used for. Now, you could be talking about phototherapy or laser therapy, but I think that would be unlikely.
Uh, Variety of different ways to try and keep your face from being consumed by metastasizing skin conditions. So,
And again, here, I think what he's saying is he's talking about prevention, so treating a very early skin condition rather than something that's already got the potential to metastasize. If something's got the potential to metastasize, you're looking at cutout and potential further therapies like radiotherapy, chemotherapy, and that would all be under the guidance of an appropriate doctor. It is quite important that you ask your patients when you do cryotherapy if they have something big coming up. I nearly froze something on a woman's face right before her daughter's wedding, and she was so happy when we decided to delay it by a month because it does come up with a big red reaction and it is quite prominent. If you're in doubt, have a chat with your local skin GP, regular GP, or dermatologist.